Being isolated at home without the ability to see friends or to get out of the house for any reason is tough. For some people, the saying safe at home instead of stuck at home doesn't resonate. Thousands of women across our country continue to experience abuse in their homes, and now they're in a confined space with the very person who's hurting them. The Provincial Association of Transition Houses and Services of Saskatchewan, or PATHS, helps women get out of those situations. Its Executive Director, Joanne Duzel, joins me now. Joanne, we've been in this state of emergency for a while now. What are you hearing from people?
Well, what we're hearing is that there are a number of calls for support, but numbers in shelters are currently lower than average. So what we're thinking is that people who are experiencing intimate partner violence right now are basically stuck between two epidemics. There is an epidemic of violence against women, and then we have COVID-19 on the other side. And so people are in a situation where they're concerned about their safety, whether they stay home or whether they leave. So the message we want to get out is that domestic violence shelters in Saskatchewan are open, and shelters are taking numerous precautions to ensure that both clients and staff can be safe from the virus, as well as keep the residents safe from abusive partners.
Joanne, what's the biggest risk for victims right now?
Well, unfortunately, the vast majority of intimate partner homicides take place in the home. So what we have right now is situations where individuals who are experiencing violence from a partner are in close quarters. They may not be able to be somewhere private where they could make a phone call to request support. There won't be other people necessarily checking in on them. For the individual who sometimes uses violence in the relationship, there's no outlet. So if someone normally is able to go for a run or go to the gym or go hang out with friends to help diffuse stress, they are not able to do that right now. So everyone is in a pressure cooker. In Saskatchewan, we are actually behind the situation that has unfolded in other jurisdictions where the virus has hit. So, for example, in France, they saw a 32% increase in incidents of intimate partner violence through the pandemic during lockdown. And news out of the United Kingdom suggests that in a 3-week period since the lockdown started there, the rate of intimate partner homicides has actually more than doubled compared to averages for those same 3 weeks over the past 10 years. So we're just at the beginning stages of this. Currently, people are staying home. We just want people to know if they feel that they're at risk, they should reach out for help.
That being said, Joanne, how do we support someone in a situation like that, but from a distance, because we've all been told to stay home?
Absolutely. There's many ways you can check in on people that you care about, whether that's through phone or text or video conferencing. The Canadian Women's Foundation has developed a hand signal that's something like this, that people can use on a video chat with a friend or a family member. So they don't actually have to say any words, but it is a call for help. So if people are interested in that, they could go to the website for the Canadian Women's Foundation and have more information about the signal and also ways in which they can support others who may be at risk.
How has support been from the government?
Well, we do know that there's money flowing now from the federal government through Women's Shelters Canada to domestic violence shelters to help support the various different expenses in this very unprecedented time. One of the biggest expenses for shelters right now is actually staff, because anyone who is experiencing any cold or flu-like symptoms must stay home for 14 days, which means shelters they're paying their perhaps permanent staff to be home to isolate until they're feeling better. They're also paying casual staff. And as the numbers of staff who are off for various reasons becomes higher, the cost for keeping the 24-hour staffing in place also goes higher. So we're happy to have those dollars flowing from the federal government. The support we've received from the provincial government is less financial, but it's certainly very good in terms of moral support, in terms of checking in, seeing what the shelters are experiencing, and helping to mitigate issues as they arise.
Thanks so much for your time, Joanne.
Thank you.